Hi, I'm Heather Smith. I'm the infection preventionist here at KSP Hospital in Dixon. I'm here today to talk to you about the increased cases of pertussis we've had in our local community so that everyone can be aware of signs and symptoms to watch for. So first and foremost, pertussis is something that we would have received childhood vaccinations on, but it is something that we are seeing more prevalent in the community at this time. With that being said, we want to watch for gradual increase in body temperature, generalized not feeling well, a cough that becomes more rapid as it progresses, and that cough will cause apnea or breath shortness in babies. So that's something we want to watch for in our infants. It can definitely be more deadly in our infant population. So with that being said, those are the things we want to watch for. And what you want to do is to make sure that you are up to date on your vaccinations. So everyone can check with their local healthcare provider or check with their records and make sure that their vaccinations are up to date. If you have not been vaccinated against Tdap, you want to make sure that you get that vaccination immediately. There's no recommendation at this current time that we need to revaccinate anybody. If you've received the vaccinations in your lifetime, then you should be covered for now. With that being said, we want to make sure if you are exposed to a lab positive confirmed pertussis case and you live in the household with that patient, or if you have been exposed at great lengths with a patient that's been positive, that you contact your local healthcare provider so that we can get you prophylaxed. The prophylaxis typically involves a 5-day treatment of azithromycin, and with that time, you do not have to refrain from work if you're being prophylaxed. However, if you do work with a high-risk population, such as with pregnant women or people that have lowered immune status, you will want to refrain from work for 5 days while you finish that course of prophylaxis. So with that, we're going to go ahead and talk about kind of what you can do. So things we can do to try to stop the spread in our community is to make sure we're obviously teaching good hand hygiene, lots of hand washing, and staying home when you're sick. So even if you have just a slight under the weather feeling, it's best to stay home, especially with the amount of pertussis we're seeing in our community. So that way we can help with not spreading germs to others. Keep your children home as well. Even if you think it may just be allergies or a cold, right now it's really hard to tell.